Welcome to our lecture on the clinical indications of the cholinergic agonist. At the end of the lecture, students must be able to have an understanding of the clinical indications of the cholinergic agonist. Start with direct-acting cholinergic agonist, betanicol. So betanicol is considered to be a muscarinic agonist. It specifically acts on the muscarinic acetylcholine receptor. For its mechanism of action, it stimulates the cholinergic muscarinic receptor on the detrusor muscle of the urinary bladder, resulting to the contraction of the detrusor muscle. We also have the stimulation of the cholinergic muscarinic receptor that are located in the GI tract, resulting in an increase in the gastric motility and increase in the pressure in the lower esophageal sphincter. It is indicated for conditions such as neurogenic bladder. When we say neurogenic bladder, that is the dysfunction of the urinary bladder due to the disease of the CNS or the PNS involved in the control of urination. It is also indicated in cases of urinary retention. Another direct-acting cholinergic agonist is the carbachol. So unlike betanicol, carbachol is non-selective. No, it is an agonist for both the muscarinic and the nicotinic receptor. Its MOA is direct stimulation of the muscarinic receptor in the eye, resulting in the constriction of the ciliary muscle and the contraction of the iris. Of course, this will result in the outflow or the aqueous humor outflow and decrease in the IOP or the intraocular pressure. This agent is indicated for meiosis for surgery through intraocular injection. So carbachol is considered to be a direct-acting meiotic agent. Another direct-acting cholinergic agent is pilocarpine. So it is an alkaloid, and it stimulates the secretion of the exocrine glands, particularly the salivary glands, and it has a direct stimulation of the muscarinic receptor in the eye, resulting in a decrease in the IOP or the intraocular pressure. It is indicated to treat xerostomia. So xerostomia is known as dry mouth. It refers to a condition in which the salivary gland don't make enough saliva to keep the mouth wet. It is also indicated as an ophthalmic drop to decrease the IOP or the intraocular pressure and to treat glaucoma. So what is glaucoma? Glaucoma is a condition. It is a condition of the eye that results to the damage of the optic nerve, resulting in the loss of vision. And one of the factors, predisposing factors for the development of glaucoma is an increase in the intraocular pressure or in the eye pressure. So this can result due to damage or an abnormality in the drainage within the eye, resulting in the accumulation of the aqueous humor. So this drug will facilitate the decrease in the IOP by allowing or facilitating the flow of the aqueous humor within the eye. So generally, pilocarpine is used medically to reduce pressure inside the eye in cases of glaucoma and to treat dry mouth or xerostomia. We also have metacholine. So metacholine is a choline ester. It is a synthetic choline ester. It is non-selective, just like carbachol and acetylcholine for the muscarinic receptor. And of course, it is a non-selective muscarinic receptor agonist. For its MOA, it is usually administered through inhalation to stimulate the muscarinic receptors on the bronchial smooth muscle to contract, or it induces bronchoconstriction. It is indicated as a diagnostic test for asthma. Since metacholine is non-selective, it will also stimulate the nicotinic receptors of the autonomic ganglia to produce tachycardia or increase in heart rate, increase in sweating or diaphoresis, and nausea. Metacholine is also indicated for smoking cessation, especially for patients with asthma. We also have the nicotinic agonist, succinylcholine. So from the name itself, it is a nicotinic agonist. It stimulates the motor end plate of acetylcholine receptors or the NM receptor. When we say motor end plate, It is located in the sarcolemma of the skeletal muscle. It induces neuromuscular blockade induction. When we say neuromuscular blockade, these are of course produced by neuromuscular blocking agents. So succinylcholine is also an example of a neuromuscular blocking drug that is used to block the neuromuscular transmission at the neuromuscular junction. So these drugs are commonly used to produce muscle relaxation as an adjunct to anesthesia during surgery and other medical procedures. Succinylcholine is classified specifically as a depolarizing neuromuscular blocking agent. We also have the indirect acting cholinergic agonists, and these are the acetylcholinesterase inhibitors. One of the examples is neostigmine. Neostigmine is indicated for the reversal of neuromuscular blockade, and it requires the co-administration of an anticholinergic agent such as glycopyrrolate to prevent bradycardia. So when we say anticholinergic agent, these are drugs that block the effect of acetylcholine at the muscarinic receptors. So basically, these drugs will inhibit the parasympathetic nervous system. Another ACHA inhibitor is physostigmine. It is also indicated for the treatment of anticholinergic syndrome and the neuromuscular blockade reversal. Is the pyridostigmine. It is an ACHA inhibitor and it is indicated for the treatment of myasthenia gravis. So myasthenia gravis is shown in this dog. The diagram shows a dog with myasthenia gravis exhibiting extreme weakness and excessive fatigue. So when we say myasthenia gravis, it is an autoimmune neuromuscular disorder characterized by weakness and fatigability of the skeletal muscles caused by dysfunction or destruction of the acetylcholine receptors at the neuromuscular junction. It presents with fatigue, dysphagia, respiratory difficulty, and progressive weakness in the limbs, leading to difficulty in movement. So the drug pyridostigmine is indicated for this condition. This is a summary of the indications of the different direct-acting cholinergic agents, starting with esters of choline. So they are used for the treatment of retention of urine, post-operative paralytic ileus, gastric, intestinal, or bladder atony. So again, when we say paralytic ileus, that means that the muscles of the nerve signals that triggers peristalsis have stopped working and the food in the intestine is not moving. Another is pilocarpine. It is useful to treat glaucoma. So of course, when we say glaucoma, that is a damage to the optic nerve resulting from the increase in the intraocular pressure. We also have the Sjogren's syndrome. So this is a syndrome of the immune system identified by its two most common symptoms, dry eyes and dry mouth. Xerostomia is of course dry mouth and neck tumors. So this pilocarpine is indicated for these conditions. We also have other miscellaneous drugs that are indicated for, again, Sjogren's syndrome and xerostomia. For the indirect acting cholinergic agonist, so this includes, for example, pyridostigmine. It is indicated for myasthenia gravis or the grave weakness of the muscle, post-operative decurarization. These ACHA inhibitors are also indicated for the reversal of neuromuscular blockade, Curer poisoning, and cobra bite. We also have physostigmine. It is indicated for glaucoma, overdose or poisoning by atropine. Atropine is an anticholinergic agent, antihistamine, TCA, and phenothiazines. These indirect acting agonists are also indicated for Alzheimer's disease. We also have the organophosphates, malathion, parathion, and carbamates, carbaryl, DDT. They are indicated as insecticides, pesticides, nerve gases, and they are highly toxic.